Hello, and welcome back to the Medical Mentor Coaching Podcast. I'm Stacey Ishman, and today we're going to be talking about when mentorship changes everything, two conversations that shaped careers. And I think we're also going to be talking about the fact that I just realized I forgot to put my earrings on. But aside from that, what I really want to go into today is now in academic medicine, it's easy to say yes to everything. Projects, talks, committees, hoping it's all going to add up. But instead, your career can look scattered. And promotion committees don't know how to evaluate you. So what you really need is a story. And I've said this multiple times, and please excuse me while I put my earrings on. Okay, total side note. I read something the other day from a psychologist who was talking about the fact that it is not natural for us to all be looking at ourselves all the time. So these online meetings where you're seeing your picture in the corner and you're looking at your face, or a podcast where your face is on the screen, are unnatural in that they actually make us overly concerned about how we look or how we present ourselves. I'm going to tell you, I just did 2 other podcasts today and I didn't notice I wasn't wearing earrings. And now when I noticed it, all of a sudden I had to fix it. So in any case, back to my story. But I will tell you, you can minimize the screen. And so I do highly recommend that because I have found myself looking at myself, which makes me not present in whatever conversation I'm having. But back to mentorship and the story you need to have in order to be promoted. So I'm sure you've all looked at somebody who it's so obvious what they're doing, and they started off doing this, and then they did that, and then they thought about this, and then that led to the next thing, and all of a sudden it's a great story. It makes sense. You understand why they started talking about sleep, and then they started about pediatric sleep and pediatric sleep apnea, and they were on the committee, and then they ran the guideline, and they wrote the papers, and they did the clinical trial. Like, it all seems like it was premeditated, and they knew on the day that they walked into the world that this is what they were going to do. And maybe that was my story, but I didn't know what I was going to do. And I knew I was interested in sleep, but that was about where it ended. I didn't even think I knew how to create a research idea on my own. And it took me a couple of years to figure out how that was going to look. And then interesting people that walked in the room and the data sets that existed that made sense and make the connections so I could do the clinical multi-institutional trials. And so all of that stuff doesn't even have to add up from the first day. You just need to know what you're interested in so you can tell that story. Now, with that in mind, I'm going to tell you a little bit more about my story and the mentor who changed my career. And it's really the story I was just starting to tell just now. But I had a clear passion for sleep medicine. I just had scattered outputs. Like, I literally had a paper on temporal bone fractures and a paper on medical student education. And I was looking at allergic rhinitis. And so if you were sitting down and saying, what does Stacey care about? Like, let's figure out how we can promote her in her career. Who knows what I cared about? Like, on paper, unless you're having a conversation with me, I looked like I was all over the place, and I was presenting things at meetings that were on varied topics. And so you couldn't look at me and say, oh, I should invite her to be on that panel on sleep medicine. You were like, I don't know. She seems like an interesting young person who is here. She's present, but I don't really know what she's interested in. I can't invite her to do anything. I wouldn't ask her to be a grand round speaker. I wouldn't put her on a panel. I don't even know if you could figure out what committee to put me on. I can tell you my chair put me on the compliance committee. And so I wrote a paper on billing, which was great. I was trying to turn my lemons into lemonade, and it was going to learn how to bill from the beginning. Thank you, Lloyd. I didn't realize it. But, it didn't help anybody looking at my CV to say, oh, well, she should be on the panel for sleep apnea. It wasn't clear. And so I have this fantastic friend and mentor. His name's David Brown. And he was working with me at the time, and he looked at what I was doing, and he knew what I was interested in. And he said, what's your one word or phrase that people can understand what you're talking about? It's like the idea of having an elevator pitch, right? I'm going to walk in and I'm going to tell you why my coaching business is going to help young academic faculty be able to take over the world and still get home on time and enjoy their life in a way that I wasn't able to do. Great. What was that? 15 seconds? I wasn't doing that for my academic career and talking about, hey, I'm a pediatric otolaryngologist who's interested in sleep medicine, and I really care about how we take care of children who are persistent sleep apnea. That's where I'm focusing my research. No, I was like, I'm doing billing and I'm doing medical student education and I'm working on a feast clinic, and all those things were true, but they didn't help somebody figure out when they would want to engage me in research or collaboration. So he said, you know where you want to go, but no one else can tell by looking at your work. So what's your one word? And at the time I picked the word sleep. And so what he challenged me to do was to put the word sleep in everything that I did going forward. And honestly, it worked. And so quickly, it accelerated my recognition. It got invited to be on panels. I had a much clearer promotion story, and that clarity was recognition. And so, um, and it didn't mean I had to stop collaborating. I also want to be clear about that. So I had a colleague who I loved working with. She walked in the room and she said, "Hey, let's work on something together about allergy," because that was her area of expertise. And I said, "Great. Why don't we look at snoring or sleep disordered breathing in people with allergic rhinitis, or the incidence of allergic rhinitis in kids with snoring?" Or, we could think of 7 other overlap options. I was talking to a friend who does otology. And while that may not be the most natural mix, we said, great, let's look at natural language acquisition in kids with cochlear implants and snoring versus non-snoring. Or I had a friend working in head and neck cancer, and we talked about whether or not laryngeal cancer caused snoring or sleep apnea symptoms, and whether that had any impact on quality life or outcomes. There's a million things you can do. And so I right away started putting the word sleep in my abstracts, in my papers, in my grand rounds presentations, in the topics I was doing, in the committees that I was joining. And so it became quickly much more apparent what I was interested in and what the impact of that would be. Now, the second story I want to tell is about somebody who was coming to me for mentorship and for guidance. And so he loved coding. He really enjoyed the policy work. He liked the business of medicine, and he was in an academic job, and he loved teaching. But he didn't really care that much about writing a paper. He didn't get all excited about the scholarship. He didn't really have that much excitement about talking about the clinical work he was doing. He loved teaching people about it. He liked the patients. But this was not where his passion lied. And so what we talked about was, how do you turn a love of the business of medicine and things like coding and policy into an academic career? So there are absolutely academic opportunities for this. And then the conversation was, what if you did your next presentation on coding? And quickly, he was actually doing coding presentations at his academy and in regional meetings and at his hospital. And he loved it. And his passion was evident. You could see that this is really what he cared about. And he was so good at it. And there are committees. There is something called the RUC. It's a group where they actually figure out the relative value of RVUs. And it's at the AMA. It's incredibly important. They help negotiate with the other specialties on how much things will be valued. And it wasn't long before he was working on a committee within our academy that worked on the business of medicine, and that was the representative to that relative value committee at the AMA. He continues to do that work and has become an expert both in our specialty and outside our specialty in things around the business of medicine and the value of the care that we do. And he just didn't have the ability to see that at the beginning of his career, how that could turn into an academic focus. And the result is that he joined that policy committee. He's on that AMA committee. He's working on coding. He's working on guidelines. And quite honestly, he's doing national advocacy to help us in these areas. And his unique expertise has really filled a gap that was important and led to national leadership roles. And quite honestly, he's also moved on to being able to use those in an insurance company and moved his way up quickly in that area. And that passion and that institutional need led him to opportunities both within academic medicine and took him to areas outside academic medicine that have really served him well, and he's happy. Now, the broader lesson I want everybody to really understand here is that alignment between what you care about and what you're doing. It can lead to recognition, and that part's nice, but much more importantly, it can let you enjoy your everyday life. And it can help other people actually give you opportunities to do the things that you care about. So hopefully the next person who asks me to do a committee is to do a guideline on sleep, or to work, in some capacity so that sleep is my primary focus. And then since that time, I've been the president of the International Surgical Society. I'm working on a guideline on sleep. I've done a consensus statement on sleep endoscopy. I'm helping other groups on guidelines in these kinds of areas. I worked with the American Thoracic Society to talk about persistent pediatric sleep apnea. But the reason I got the opportunity to do the things that I have a passion about is because I made it clear what the area was that I cared about and allowed other people to actually then say, great, here's the gap. We want to give that to you. So if somebody reads my CV, there's a story. And I will tell you, when I get a new client in my one-on-one coaching, I usually look at their PubMed. And what I'm looking for is to see if I can figure out their story without them telling me. So if it's clear that like the word sleep isn't everything and it went on to being pediatric sleep apnea and then it was more sophisticated or specific, to persistent sleep apnea in children, I kind of understand the story there. I can see what makes sense, and it's easy for me to see how I can tell that story to a promotion committee. But it's not uncommon for me to look at a CV that looks like mine did at the beginning, where I'm like, oh, she did a temporal bone fracture paper, and then she talked about allergies, and then this one's on allergic rhinitis, and here's something on medical student education, and here's something on sleep, and well, I don't really know what she's interested in. And there's an opportunity to have that conversation. And I'm going to tell one more story, which I love. And I was in the sleep area. I was asked to do a panel on sleep apnea by a junior faculty member, and she did an amazing job. She was so organized. She made it easy for me. She did all the slides. She sent it out ahead of time. She solicited questions on cases we might want to add, but like all I had to do is show up. And I look good. She made me look good. I answered great questions. We had really interesting topics to talk about. I could talk about my own patients if I wanted to add a patient story. And I was so impressed that afterwards I said, what can I do to help you? Like, I really think you've done an amazing job. You're somebody I'd love to give opportunities to. What are you interested in? And what she was interested in was being known for pediatric ear disease. And the first thing I said was, okay, this was an amazing job. You have a great gift. You have great skill. You have to stop giving this mini seminar or this panel. Like, you should never give this again. And she was like, what? It was great. She did a great job. But what you need to be doing is the same thing on whatever your topic is in pediatric ears. What are your burning questions? What do you want to know about? Who do you want on that panel? Who do you want to think, how can I help you? You did a great job. And so she went on to create, the next one that was about pediatric ear disease and to invite the people. And I said, okay, great. Let me help you find some of those people, because this is clearly what you should be doing. You do a great job at it, but let's do it in the area that you care about. So people know that this is your niche, and it's absolutely her niche these days. But some of us just don't realize at the beginning of our career that we have the opportunity to create that narrative and to find the people who can help give us the next opportunity that we're looking for by raising our hand and making sure people understand what we're interested in. So I just want to really reinforce success is not about doing more. It's about doing the right things consistently. So I want you to audit your PubMed, look at your CV, and see if they reflect your goals. So if you are working with this on your own, talk to your peers, make sure they know what you want to do, talk to your mentors, talk to your sponsors. They can help you find these opportunities. And if you need a coach, please reach out and give me a call. Or if you want to look for departmental coaching so we can help your whole group get on the right path and figure these questions out, please talk to your chair so we can have some conversations about that. Now, in the meantime, please share this with somebody who you think might benefit from this information. And please rate, review, and subscribe to the Medical Mentor Coaching Podcast on your favorite podcast app or on YouTube. Now, if you want to get in touch with me to share feedback or ask questions or let me know if there's something you're interested in doing, please get on my email list at medicalmentorcoaching.com or DM me at @Ishman Coach on Instagram, or message me on LinkedIn. I look forward to talking to you next week, and I hope this was helpful.